Imagine if breast cancer treatment could be tailored specifically to each patient, rather than using a one-size-fits-all approach. Thanks to precision medicine, this is now possible. By studying the genetic makeup of cancer cells, we can now select treatments that directly target the disease, improving outcomes with reducing side effects. Today we're exploring how targeted therapy is transforming breast cancer care and how this approach is changing the future of oncology. So what is precision medicine? Precision medicine uses molecular tests to understand the unique characteristics of a patient's cancer. Some tests look at alterations in specific genes, DNA in cancer cells, RNA or proteins. So instead of treating all cells the same, now we can analyze the tumors and determine which treatments will work best. This personalized approach helps make treatment decisions and cancer therapies more effective, avoiding side effects from medication. For example, HER2-positive breast cancer, which tends to grow and spread quickly, was once difficult to treat. But researchers discovered that HER2-positive tumors produce extra amounts of a protein called HER2, which fuels cancer growth. This led to the development of targeted drugs like trastuzumab or Herceptin, pertuzumab, also known as Perjeta, antibody drug conjugates like Enhertu, and many others that specifically block HER2, slowing or stopping the cancer. These treatments have significantly improved survival rates for patients with HER2-positive breast cancer. The power of targeted therapy is significant. Unlike traditional chemotherapy, where all cells are being attacked, both healthy tissues and cancer cells, these cells are more selective, so there are fewer side effects. Other examples of important targeted therapies for breast cancer include the CDK4/6 inhibitors. These drugs like palbociclib, ribociclib, abemaciclib help stop hormone receptor positive cells from growing and work best in combination with hormone therapy. PARP inhibitors in patients with BRCA mutations, BRCA mutations in the germline can also target cancer cells more effectively. Another breakthrough in oncology is liquid biopsy, a simple blood test that can detect tiny fragments of DNA in the bloodstream. And this allows doctors to monitor treatment effectiveness and detect cancer cells earlier. But there is an important distinction between genetic testing in healthy individuals, called germline testing, and tumor genetic testing or somatic testing in cancer patients. Both provide very valuable information, but they have different purposes. Genetic testing in healthy women is looking at germline mutations in genes that we're born with. And those patients, for example, if they inherit a BRCA1 or BRCA2 mutation, that increases the risk of breast cancer, ovarian cancer, and other types of cancer in the future. And those are in all cells in the body. Other genes like PALB2, CHEK2, and ATM can also increase breast cancer risk. When a patient has cancer, then we analyze the tumor itself, looking at the DNA for mutations, RNA or proteins, to see what kind of tumor we're dealing with and also decide what's the best treatment. So tumor genetic testing helps personalize treatment, allowing doctors to choose the most effective therapy while avoiding unnecessary treatments that are unlikely to work. So why do both types of testing matter? Germline testing helps identify high-risk individuals before cancer develops, allowing them to take preventive steps. Tumor genetic testing helps guide treatment decisions in people who already have cancer, leading to more personalized and effective therapies. A woman with a BRCA mutation, germline testing, may take steps to prevent cancer before it starts, but if she later is diagnosed with breast cancer, her tumor may also be tested, somatic testing, to determine which targeted therapies would work best for her specific cancer. So both types of testing play a role in precision medicine, bringing us closer to more personalized cancer prevention and treatment strategies. So stay informed, stay proactive, and remember, the more we understand cancer at a genetic level, the better we can fight it. While precision medicine is transforming cancer care, challenges remain. Targeted therapies can be expensive, and access to genetic testing is not yet universal. However, as more research is done, these treatments are becoming more widely available. Additionally, not all breast cancers have clear genetic markers or tumor markers we can target with therapeutics, and that's why we need to keep doing research, finding for those new markers in the specific tumors. So looking ahead, precision oncology may improve breast cancer and other solid tumors. We're trying to find ways to improve personalized care using, for example, artificial intelligence and machine learning to try to identify this type of genetic markers quicker and figure out which treatments would work best for each patient. We're hoping also that these targeted therapies will have fewer side effects compared to standard chemotherapies. So if you or a loved one has been diagnosed with breast cancer, genetic testing could open the door to more advanced and effective treatment.